Thank you. Obviously, the public-private partnership theme is a very important one. I was approached previously with the question, can a company that produces products that can be misused contribute to public health, to community health, and the needs of the community? And that's the issue that is core to this public-private partnership theme. Lisa's point from the previous panel pointed out that there are resources that are not exactly readily available in our society. Having previously worked for government for over 30 years, I can assert that government cannot fund all of the public health practical solutions or research solutions that are necessary. So the question is, can there be a model where these contributions can exist? And I think that there in fact can be. We do recognize and have to recognize that there are potential conflicts when industry engages in global health. We need to recognize that people and organizations, there's a tension between serving multiple interests. The potential conflicts exist in terms of the public health working with business and the business plans. But these conflicts can be mitigated, and they don't, by definition, mean that there is wrongdoing. We have to recognize that there is that tension and we can resolve it. These conflicts can arise if the stated public health goals begins with, no, we don't want the contributions from industry. In fact, we can alienate the contributions from industry in our zeal to elevate public health to, shall we say, a celestial model of intervention. And in my mind, coming from the community, this creates tension between public health paternalism and the community, as well as industry, as well as government. Because remember, government, other people have been saying government does not have the resources to address in a comprehensive way some of these problems, and so we need to figure out how to do that. We know that education is needed to help business understand the culture of public health, the mores and the ethics of public health, and the importance of mitigating potential conflicts and keeping secondary interests from overwhelming the primary public health agenda. On the other hand, we have to keep in mind that the people have a voice in this discourse, and one of the things I actually haven't heard in this discussion is, what does the community want? And we need to be able to influence through nudging as well as regulation what the community wants, because the community does rebel. And that's something that we have to keep in mind. We have to manage and mitigate these conflicts through transparency, who gets funded, by whom, who decides the funding, how the programs operate, who makes these programmatic decisions. That's one of the reasons why when the foundation and the company decided on community-driven steering committees, I thought that that was very important to this decision about the issue of paternalism and who gets to decide. We have to separate decision makers on funding from the recipients of funding and limit the value that's exchanged and using multiple partnerships, and we also have to have people who are willing to recuse themselves from the decision-making process when conflicts are manifest. When partnerships use the company's core competencies, this issue of core competencies was discussed. Education and communication to ensure program goals remain constant, and we can have a robust and fully independent evaluation. And we also need to scrutinize all of the people who participate, including the public health advisors. At the technical advisory group, we're a group of people who have some expertise in alcohol science, prevention, treatment, measurement, and evaluation, health communications. We advise the foundation, the steering committees, the company, and our academic partners, and we are sensitive to the issue of the conflicts. And so not only are we reading the literature, we're examining what we're doing. We try to avoid conflicts of financial gain. We make sure that none of our members have any substantive ongoing contracts to execute programs, and we again recuse ourselves as appropriate. The key theme here is we've had problems with the misuse of alcohol for a long time. Can we develop solutions to mitigate those problems? And if it's clear that the government cannot do it and does not have the resources or the will to do it, then we have to reach out to everyone in the community, because, as Allison pointed out, it's not good for the company, it's not good for the people in the community, and it's not good for our larger society. That's why business can participate in this, and business has a sustainable interest in it. What the foundations discuss, who were talking about the financing, what happens is foundations lose interest. And so the question of sustainable interest becomes a major issue. I just read one of the foundations in our community in the United States has decided they were no longer interested in prevention, that was no longer their goal. They've been doing it for 10 years, and so prevention needs to take care of itself. So, you know, the question then for the community is, wait a minute, prevention issues are ongoing issues, are sustainable issues. They just don't go away when the interest wanes. So can we invite the private sector in addressing some of these key issues? Prevention is one of them. And as Sir George pointed out, we have to focus on the living, not just be concerned about the dying or the dead. And in order to focus on the living, we need all people who are invested in the living to be in the room to make the appropriate decisions, to also make sure that there are sufficient resources, but both economic as well as intellectual, to address those problems.